Don't take these medications until you know this. You trust your doctor. You trust the pharmacy. But what if the very medications you're taking to feel better are silently causing long-term harm? Every year, over 100,000 people in the US are hospitalized due to adverse drug reactions, and many of them were taking prescribed medications exactly as instructed. Most people never read the fine print. They're unaware of the nutrient depletions, hidden side effects, and long-term consequences that can come from common medications, especially when taken for months or years. In this video, we'll uncover the medications you must think twice about, how they affect your body and brain, and what you can do to protect yourself, starting today. Stay with me through topic 5. We'll share key questions to ask your doctor and alternatives to explore. Don't forget to like, subscribe, and share this video, especially with someone who takes medications daily. 1. The hidden risk. Why common medications can be dangerous. Medications save lives, but they're not without risk. And the truth is, most people take them without understanding how they work, what they deplete, or what they interact with. The dangers are often not immediate. They build up slowly, over weeks, months, even years, until you suddenly face new symptoms, nutritional deficiencies, organ stress, or dependency. Why this happens? Doctors often don't explain long-term side effects. Patients rarely question the prescription. Drug interactions are overlooked, especially when taking multiple meds. And here's the worst part. Some side effects are treated with more medication. This creates a cycle of over-medication that's hard to escape. Real health comes from informed decisions. You have the right and responsibility to understand what's going into your body and how it may affect you in the long run. 2. Painkillers and anti-inflammatories. What most people don't know, over-the-counter doesn't mean risk-free. Medications like ibuprofen, naproxen, and other NSAIDs, non-steroidal anti-inflammatory drugs, are used by millions, but few understand their full impact. Short-term relief, long-term damage. These medications work by blocking inflammation and pain, but they also irritate the stomach lining, leading to ulcers and GI bleeding, reduce blood flow to the kidneys, causing kidney stress or damage, affect heart function, increasing risk of high blood pressure and heart attack, especially with long-term use. And the danger multiplies when taken daily, on an empty stomach, with other medications like blood pressure or blood thinners. Real cases. Thousands end up in the ER each year from NSAID-related complications. Yet these drugs are marketed as safe for daily use. Doctors' advice: use NSAIDs only when necessary, never on an empty stomach, and avoid long-term use without guidance. Explore safer pain relief alternatives like turmeric, magnesium, physical therapy, or anti-inflammatory diets. 3. Acid reflux drugs, PPIs, linked to long-term health issues. If you've ever suffered from heartburn, you've likely taken a proton pump inhibitor, PPI, like omeprazole, pantoprazole, or esomeprazole. They're among the most prescribed drugs in the world, and they're also dangerously misunderstood. These medications reduce stomach acid to relieve reflux, but stomach acid exists for a reason. The hidden risks of long-term PPI use. Nutrient malabsorption. Low stomach impairs impairs absorption of calcium, magnesium, iron, and vitamin B12, leading to fatigue, muscle weakness, and anemia. And bone fractures. PPI use is linked to increased risk of osteoporosis-related fractures, especially in the hips and spine. Kidney damage. Studies show long-term PPI use may raise the risk of chronic kidney disease. Dementia risk. Some research suggests a correlation between PPIs and higher rates of cognitive decline, particularly in older adults. Rebound acid. When stopped abruptly, PPIs can cause worse acid reflux than before, trapping people in a cycle of dependency. Doctor's advice: use PPIs only as a short-term solution, for 8 weeks max. For long-term relief, focus on root causes, improve digestion through diet, weight management, and gut health. Don't stop PPIs suddenly. Wean off under medical supervision. 4. Antihistamines and sleep aids. Cognitive side effects. You might reach for them when allergies hit or when you just can't sleep. But antihistamines like diphenhydramine, Benadryl, or over-the-counter sleep aids that contain it are not as harmless as they seem. These medications work by blocking histamine, a chemical involved in alertness, which is why they make you drowsy. But here's the catch. When taken regularly, especially in older adults, these drugs are linked to cognitive decline, memory loss, increased risk of dementia and Alzheimer's disease. Why? They block acetylcholine. Antihistamines are anticholinergic, meaning they interfere with a key neurotransmitter, acetylcholine, that your brain needs for learning, memory, and focus. And they're everywhere, in nighttime pain relievers, allergy pills, and even cold medicines. Red flags: using them more than twice a week, daytime grogginess or mental fog, needing higher doses to get the same effect. Doctor's advice: avoid long-term use of first-generation antihistamines. For allergies, opt for newer non-sedating options like loratadine or cetirizine. For sleep, build a better routine with magnesium, melatonin, and sleep hygiene before turning to pills. 5. Smart rules before taking any medication. Medications can save lives, but only when used wisely. Before starting or continuing any medication, here are 5 essential questions every patient should ask. 1. Why am I taking this? Don't accept just-in-case prescriptions. Make sure the benefit outweighs the risk, especially for long-term use. 2. What are the side effects and nutrient depletions? Many medications drain the body of key vitamins and minerals. Ask about common deficiencies and how to prevent them with diet or supplements. 3. How long should I take this? Most drugs aren't meant for lifetime use, but people stay on them for years without reassessment. Always revisit the plan with your doctor. 4. Does this interact with anything else I take? Include over-the-counter meds, herbs, and supplements. Dangerous combinations often fly under the radar. 5. Are there non-drug alternatives I can try first? Sometimes diet, movement, stress management, or natural compounds can be just as effective without the side effects. Doctor's advice: you are not being difficult for asking questions. You are being wise. Be your own health advocate and never start a medication blindly. Take control before you take that pill. You deserve to feel better, but not at the cost of your long-term health. The truth is, many common medications come with serious risks, and too often, those risks are never fully explained. But now, you know what to watch for. Let's recap. 1. Medications can have hidden dangers, even when used correctly. 2. Painkillers and NSAIDs can hurt your heart, kidneys, and stomach. 3. Acid reflux drugs may increase your risk of fractures, dementia, and nutrient loss. 4. Antihistamines and sleep aids can quietly harm your brain over time. 5. You must ask smart questions before starting and explore natural alternatives. Medication isn't the enemy, but uninformed use is. If this video helped you, hit the like button, comment below with your experience or questions about medications, and subscribe for more life-saving health tips. And please share this with someone who takes meds daily. It could protect their heart, brain, or future. Remember, your health is your responsibility. Never swallow anything without knowing the truth first. Don't let medications silently harm you. Did you know that over 100,000 people are hospitalized annually due to adverse drug reactions? It's time to be informed. In our latest video, we dive into the hidden risks of common medications, like painkillers and PPIs, that may cause long-term damage. Plus, we share essential questions to ask your doctor and safer alternatives you can explore. Your health is in your hands. Take charge and watch your health flourish. Like, subscribe, and share with someone who needs to hear this. Your knowledge could save a life.